Getting up close and personal, a campaign must, but in a pandemic? Brazil's Jair Bolsonaro considers lockdowns excessive. A show of strength? Britain's Boris Johnson landed in intensive care with the coronavirus after shaking patients' hands.
Birthday, dear Mologic. Thank you very much indeed. Happy birthday.
People who've worked closely with him say he considers illness a sign of weakness. In February, President Donald Trump announced the disease would just disappear.
And it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left. Okay.
The US has the highest death toll. It continues to rise. 3 world leaders accused of incompetency, and they are all men.
Hi, I'm Ben Fazulin. Women are leading the way in this crisis. There are enough examples, as you'll see in a moment. But is this a revolution of women, or are we seeing a crisis of competency by so many male leaders around the world? I'll be talking to an expert about that later in the show. First, here's DW's Kate Ferguson on gender politics.
Clear communication, quick, decisive action, and a willingness to listen to science. Just some of the accolades these leaders have received for their handling of the coronavirus. And yes, they have one thing in common. Take Taiwan. Learning from the SARS outbreak in 2003, leader Tsai Ing-wen acted faster than many of her international counterparts by banning travel from China early, implementing strict health screenings, and increasing the production of face masks. The result? Taiwan has recorded well under 500 cases so far. Australia, an island nation with a similar-sized population, has more than 10 times that. Then there's New Zealand. Its leader, Jacinda Ardern, has been pursuing a strict policy of elimination. The result?
Our transmission rate, that is the number of cases that each person with the virus passes it on to, is now 0.48, less than half a person each. Overseas, the average is 2.5 people. We have amongst the lowest number of confirmed cases per 100,000 people in the world.
Another key feature of a successful response to the crisis, not resting on your laurels. After announcing a loosening of lockdown measures in Germany, Chancellor Angela Merkel continued to call for caution. We do not yet know what the consequences of easing restrictions will be. That's why we have to act step by step, slowly and cautiously. Not every female leader is a good crisis manager, and not every male leader is a poor one. But early evidence from this pandemic suggests that being led by a woman could be good for a nation's health and its wealth.
Jennifer Curtin, University of Auckland. Your work focuses on women in politics. I don't want to get into a battle over man versus woman, but tell me, are women better at managing crises like this pandemic?
Well, I think that's the impression that's certainly being promulgated through the media at present. But I think part of the reason why we're seeing this debate happen is because women remain rather novel as political leaders, perhaps outside Germany. And also what we're seeing is an increase in the number of younger women who are taking leadership at a time when we are seeing such a significant crisis. So I wouldn't necessarily buy into the argument that women are better at managing crises. It's more that there's an increased number of women during what is this exceptional crisis than what we've seen in times past.
And therefore a higher percentage of female leaders who are doing a better job. What can the men learn from them then?
Well, I think part of the reason why we're seeing women political leaders doing so well and being reported positively during this time is because there are several high-profile male leaders that are taking quite a contrasting approach to managing this crisis. And so some have reported this as a rather aggressive, unnecessarily perhaps aggressive rhetorical approach, one that some have portrayed as hypermasculine. And so the contrast then between empathetic, resolute women leaders and perhaps hypermasculine male leaders is quite extreme and quite contrasting, and so more noticeable.
You've pointed out that experts say women will pay a higher price due to this pandemic. I thought the fatality rate's higher among men.
I think it depends on what you're counting as the impact of the pandemic. So, yes, death is one of the most severe outcomes that we're seeing, but we're also seeing quite stringent policy responses in some countries, including lockdowns. That's what's happening here in New Zealand and other countries too. And so we know that when this happens, women tend to take up the majority of caregiving. They're also then expected to work from home and still manage the children. A majority of health sector workers are women. So there are challenges in this space for women compared to men.
Could this crisis help put the spotlight on women and highlight the extremely important role they play in society and perhaps even see more women move into leadership positions?
Well, I certainly think that the role modelling effect of Merkel in this crisis, our own Prime Minister Jacinda Ardern and others, is giving a message, a symbolic and a substantive message to younger women that politics and crisis management is not to be feared. But I also think that the policy reconstruction that's going to have to happen in a post-COVID environment is going to be challenging for policymakers to rethink and how they're not just going to rebuild infrastructure in our case, but also social infrastructure. So there is a real opportunity for policymakers here to reimagine a different way of the economy working that values a lot of the work that women have done that hasn't been recognised as valued before, particularly the unpaid care work that women have been undertaking that's certainly propped up GDPs in the past.
Jennifer Curtin, Director of the Public Policy Institute at the University of Auckland. Thank you.
Thank you.
Our science editor, Derek Williams, has also been busy answering questions again. Your queries on the coronavirus. Here's what he had to say.
Is the virus airborne?
There's a lot of debate on this question, and the short answer is that at this point, we don't really know. The WHO continues to say that the primary way SARS-CoV-2 transmits from person to person is via larger droplets emitted when someone sneezes or coughs. Those are droplets that don't remain airborne for very long. But can the virus also enter the air and infect others when someone who has it simply breathes out as much smaller droplets that scientists call aerosols? Aerosols remain suspended in the air for much longer than larger droplets do, and they travel further. If we knew for sure they presented a danger, we would have to make some fundamental changes to how we're dealing with the disease. But people who work in the field say proving airborne transmission will be a difficult task, and the scientific evidence so far remains pretty mixed. Some studies say airborne transmission is likely, others say it's less so.
A number of viruses can remain in the body even after infection, hidden from the immune system. Does SARS-CoV-2 do that?
What you're talking about are viruses like HIV or ones from the herpes family. After you've been infected with them, they're able to evade the immune system by entering a latent state, though later in life they can and they do flare up again. They reactivate. After South Korea recently reported some patients who recovered from COVID-19 had subsequently tested positive again for it, experts have been scrambling to explain why, and coronavirus latency and reactivation is seen as one possible explanation. In general, most of the virologists that I've read seem to think it's unlikely, as coronaviruses in general don't have life cycles that involve latency and reactivation. But nobody, including the WHO, is ruling out the idea completely at this point.
Can a steam sauna inactivate SARS-CoV-2?
This was the folk remedy recommended by the president of Belarus, along with drinking lots of vodka. Unfortunately, though, neither of those remedies works. Taking a sauna won't prevent you from getting COVID-19, and it won't cure you if you have it. Although the virus would be killed by prolonged exposure to high temperatures on surfaces, your own core body temperature doesn't really change in the few minutes that you're in a sauna. If it did, you would die. So, although taking a sauna might help lighten your mood, don't expect it to offer either prevention or cure. And only do it if you're lucky enough to have a private sauna at home. Definitely stay away from any public facilities at the moment.